So in addition to the individual and group therapy, the music therapy, mindfulness, equine therapy, there's also medication management services. Warriors that come through this program get an evaluation by a psychiatrist or an advanced practice nurse. If the goal is not to push medication onto anybody, the goal is to really have an open conversation about the best treatment options. And so that's another aspect that really makes this an individualized and tailored approach to care. The kind of medical evaluation component of treatment oftentimes starts during the intake process. The clinicians at each academic medical center work very closely with the Warriors' current providers. If they're already seeing a mental health therapist, they're going to call that mental health therapist and they're going to ask them, with permission, of course, they're going to, ask how this person was doing. They're going to get, a progress update and really look to, be on the same page with the mental health therapist. They're also going to reach out to any other medical providers. If the individual is already seeing a psychiatrist and is prescribed medication, the clinicians at each academic medical center will talk to that provider to really determine the best course of action. Because as we've talked about, the Warriors are only in treatment for 2 weeks. So making sweeping medication changes is not something that would likely happen in a 2-week intensive outpatient model. What would happen if it's determined that some medication changes need to be made, perhaps that's done during the intake process, where they're working again with that outside provider to really figure out what the best course of action is. And then on the flip side, when they return home, there's conversations between the providers at the academic medical center and the provider that warrior is going to go see when they go home, all in service of continuity of care.
BrainLine is powered in part by Wounded Warrior Project to honor and empower post 9/11 injured service members, veterans, and their families.